Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Bostic series. This audio podcast is part of a Loboxing faction. This audio podcast is part of a Storm Quota, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, sort of continuing from the previous, this audio podcast will now sort of delve into the sort of discussion aspects of this audio podcast in this sort of drafted works from early 2023. So ensuring allied health professionals or AHP, the AHP workforce, including healthcare scientists, have adaptability to advance online spaces prospectively will be pertinent to accomplishing parity in patient care by 20 by as a, in evidence works by 2030, allied health professionals or HPs, including the sort of variety including the variety of AHPs, could perhaps expect to be better integrated into healthcare services, being more involved in multidisciplinary team working or MDT working, and so, for example, through online group consultations or similar. This would prompt smarter working on relationship between patients and healthcare professions to envisage an all-encompassing approach to those who suffer with CKD, chronic kidney disease, and see that there are better outcomes for patients. There is also a potential role for AHPs to support and support to support to support and be and to support and be involved in initiatives such as online spaces to bridge gaps in information providing and uh, and um, and preclude misinformation. The potential of or for allied health professionals to help improve the quality of guidance in this context still requires enhancing and further reflection. Prospectively, however, research should explore investigate involvement of AHPs like that of similar research that had been evidence in particular in works in particular around works from an author in around 2018 and around works from an author in 2018 and regarding to digital practices. So, for example, healthcare services could be organized through AHP-led e-clinics to support patients to contribute to best practices. At the same time, between the two international social media platforms, 2,516 threads were tagged against 14 educational topics over a 1 month duration. Retrospective trend analysis provides a snapshot, and analysis reveals that patients between both adult and pediatric cohorts still require additional support across several areas of kidney care. It has been construed that the majority of studies focus in MDT clinics or multidisciplinary team clinics incompletely report clinic structure and function. Healthcare service through social media online platforms would be better supported involving AHPs and providing e-clinics online or in other format, wherein, for example, focus-based scenarios to help encourage and enhance shared experiences and knowledge sharing. Surveys did not involve a scoring system, since this would have made analysis and completion challenging. Online versions of surveys were also shortened, and simple tick box method was applied. 19 surveys were completed by allied health professionals, and 45 had been completed from patients with CKD. Respondents from patient cohort had demographics with varying ethnicity, age range, and gender representation. Respondents from a professional cohort were predominantly from white or Caucasian backgrounds, higher education status, and primarily from female backgrounds. AHPs, allied health professionals that contributed included healthcare scientists was in around 47%, in around nephrologists 17.65%, allied health professionals generally 17.65%, general practitioners around 5.88%, and patient cohort included transplanted recipients in around 60.53%, hemodialysis recipients in around 13.16%, and CKD patients generally through CKD severities 3 through 5 in around 10.53%. As part of the discussion, education needs to be implemented to achieve best practice. In around some aspects of the statistical justifications. So. Regarding previously related or published works from an author in around 2020, the current or present work sought to implement a similar methodology. However, a target sample selected differed, wherein the response rate sought to gain 100 responses between CKD patients and allied health professionals through the social media platforms. Even though participants were invited to complete survey once, this did not increase the survey response rates, and from descriptive analysis 30% of surveys were completed by AHPs and 70% were completed by CKD patients, and conducting a descriptive analysis surrounding the data set was best owing to the set target set target sample. And what can be inferred from this research is that online polls versus surveys work better than online polls work versus surveys work better through social media platforms, because research investigators must be also willing to interact and support online populations. In around the sort of strengths and limitations of this works is that one of the main limitations of this investigation relates in regards to a number of survey responses from both allied health professionals and CKD cohorts. Respondents from patient cohort had demographics with varying ethnicity, age range, and gender representation. Respondents from professional cohort were predominantly again from Caucasian or white backgrounds, higher education status, and again primarily from female backgrounds. Though there is a limitation regarding the generalizability of the data of pilot data collection, a greater use of skill mix is important if AHPs or allied health professionals and patients want to see best practice beyond the confines and constraints of traditional consultations. The aim should be to equip allied health professionals and patients with knowledge base to ensure that there are mutual objectives between service users and service providers. Thus, to also ensure advanced practice is envisaged between healthcare sectors. That draws this audio podcast to a close. This audio podcast as part of a Bostic series. This audio podcast as part of a LaBox infaction. This audio podcast as part of the Storm quota, and this audio podcast as part of a Storm Robotics production.